By now, APOPO is an organization with 650 employees in various countries. I'll come back to that. In total, we cleared 104, and this teller is continuously counting on our websites. So over 100,000 explosive devices have been neutralized. Probably 21 something or 22 million square meters of land returned to villagers and affecting, by now we're over 1 million people, I think, that have been able to return to their villages. That's on the mine action side. You also see detecting TB, and well, now already more than 10,000 people who live with tuberculosis, pulmonary tuberculosis, and who haven't been identified by the standard WHO technology of microscopy have been identified by the rats. And the implementation of this technology has increased case detection rates by the government service continuously by over 40%. And we have been doing that in, yeah, that's incredible. Huh? If you go to a hospital in Tanzania and you have active TB, the chances that you will be detected are less than half, 48% actually, somewhere ranging between 30 and 70%, depending on the remoteness of the health center that you're reporting to. But it is actually astonishing that these case detection rates are so low. It's better to throw up a coin. You have more chance that you'll be detected, or yeah, than relying on a routine microscopy test. Appalling. Yeah, and that's why we're also rolling this out. In spite of WHO, who, well, and I'll come to the performances of the rats, WHO requires a very high sensitivity and a very high specificity, and rats simply don't have that. Let me tell you how this works. So people report to a health center in a city or a big town with pulmonary complaints, and they produce a sputum sample. They are sent home with another container, and the next morning they're taking another sputum sample. These 2 samples per patient are screened by microscopy. What we do is, with a motorbike, we send around people to collect all these samples from all these hospitals, both the positives and the negatives. They come in, we inactivate all these samples. 30 minutes of heating them at 90 degrees is sufficient to make TB inactive. And then they're put in a setup that, as you just saw, they get rewarded on the positives, but they also indicate quite some negatives. And it's especially these negatives, then we research them again. We first centrifuge these sputa, look at it with a fluorescent microscope, and if still discrepant results with the rats, we use a gene expert to confirm it. But all this together creates a cost-effective health intervention, and that's really what it is about. It's about early detection of TB cases, because every undetected TB case infects up to 15 people per year. In countries like Tanzania and Mozambique, and now also Ethiopia, where we've implemented this, people don't have addresses. They have a postbox number, so in order to be able to trace back people, we use mobile phones. And it's really important. It's like somebody like Nuru is, well, she has 36 grandchildren from 5 children, which is not uncommon in a country like Tanzania. She has been 3 times misdiagnosed by a health center, and she was brought into the APOPO lab on a door because she couldn't walk anymore. So they had taken out the door out of the house. Nuru was slim like, well, and now she, in African terms, culturally, when somebody's well in the fat, it's considered healthy. So she's now doing well. Importantly, she was the only earner, or she's the only one within the whole of that family had an income. So she was responsible for 41 people, her kids and her grandkids, for an income. So, and I just mentioned this because of it's not because we can find even one patient, well, that can have actually sometimes impacts up to more than 40 people. On average, there's 5 to 8 people depending on one person.